All right. My time in the hospital, man. As you can see in the videos, I was like really, really depressed, and it. I mean, honestly, who wants to be in the hospital other than to get healthier and whatnot? But it's holiday season, and you want to be around people. I mean, which is kind of like ironic because I'm an introvert and I don't really like being around people. I'm more to staying around by myself, but you want to be around people in this time. But before I talk about before I you know elaborate more about the hospital, uh, I'm gonna take y'all all the way back to like the events leading up to it. So in March, coronavirus hits America hard. So we go into the shutdown thing. I think I gained about 200 pounds. I ended up at 215. And, I decided, I'm going to go for walks and jogs and work out and stuff. So, you know, uh, the walks didn't really last that long. I mean, I did 8 miles, but like in terms of days, it didn't really last that long because out of two instances, it happened. The first time I didn't really think nothing of it, but the second time, my right calf started, uh, kind of like swelling up, getting stiff, and then like the shin splint part. And with shin splints, I've been getting that since high school because when I run, it's more flat footed. I'm not the type who like heel toe. I'm not the type to go heel and then go up to the toe and make the wave. It's like more smack the ground and then go like, and that's something that I kind of been trying to work on, more heel toe wave than just complete smack on the ground. So that's where I thought the shin splints was coming from the first time, uh, or that's why yeah, where it was coming from the first time. So I didn't really think much of it, but also my hands would turn bluish purple and get like a frostbite feeling to it. So uh, I ended up going to patient first. Um, it's a it's not an emergency room area. It's more like for primary care doctors. But I didn't have a primary care doctor, so I ended up going there. They did their X-rays, their stuff, and like that. And I was telling them because I also had symptoms of um, shortness of breath and whatnot. Um, there would be times where my heart heart rate would go up to like I think like 120 was the highest. And honestly, think I think I died in my sleep. I was laying in bed and um, I just like woke up gasping for air and everything. So I want to say I suffocated in my sleep. Not sure. Maybe I don't know. Maybe y'all might have the answer for me. I'm not a doctor or anything, but so yeah, I ended up going to patient first. So because I had asthma, we first started with asthma for the shortness of breath, and my inhaler medicine was all out, so I needed a refill on that. They also prescribed me some pill. I forgot what the name of it was, but it was to help with inflammation in the lungs. Um, because I had like this part right here, this area right here. I felt like it literally felt like somebody's fist was in my chest, and it was hurting so bad. Um, so I did the pills. I did the my inhaler, but that didn't work, and we were looking on the x-rays and stuff, and it's like there's no issues, but there was like little white dots and whatever. uh so when I was about to leave, he put the x-ray up, and I seen like little white dots in like the vein areas, and like I don't think he was gonna bring it up or anything. But then I was like, so what are those little white dots? He was like, those are probably calcium deposits and whatnot. So calcium buildup or whatever. Um, so I didn't really think much of it. Time goes past. We're talking between April and uh, early November, mid November, April to mid November, and I have no health issues. Everything's going smooth. No more shortness of breath. No more hands turning blue, purple. No more calf swelling up or anything. And everything's fine. And then November 19th is all right. So November 19th, I'm at work. I'm at my desk. Um, and out of nowhere, my head just starts spinning and starts spinning fast. And then I started getting hot. So I walked outside, to get some cold air, and then I bought a Sprite and a Kit Kat, so I could have just something, to eat and drink. All of a sudden, it went away. I went home, kind of had like a little bit of chills, so I stayed in like the shower for like 15 minutes. Um, like I showered for maybe 3 minutes, and then it was just me, just standing under the water for like the rest of the time. Friday, November 20th, um, I come home, and then I really had chills. So then I was under the shower again for another 15 minutes and whatnot. Um, the 21st, I was supposed to go to work. Um, so the shortness of breath comes back. So I'm thinking that it's asthma. So the shortness of breath, and I also had like tightening in this area. So I'm thinking, could be another asthma attack, whatever. I do the inhaler, and I get in my car and I go. Now I'm probably 1.5 miles away from work. All of a sudden, this whole side, like a little bit of my shoulder, main part of my ribs, my chest, and my shortness of breath all tighten up. So I hit a U-turn. I go all the way back near my house, which is about 9 miles. I go to Giant. I got me some ibuprofen, and then I went home. I lay down, went to sleep. I didn't call my job or anything, which I should have done, but at the time, I'm thinking I'm about to die or something or whatever. And I slept the rest of the day. Uh, I think I slept from 3 till like 8ish or whatever, because my mom walked in the room. I'm a really light sleeper. Like there's no walking up on me and surprising me. Like even if I'm just laying there, whatever, uh, I pretty much fake sleeping at that point. Like as soon as you open the door, I'm pretty much fake sleeping now, because now you woke me up out of my sleep, and now it's like, what do you want or whatever. But yeah, I think she was about to offer some food or something, but yeah, then I went back to sleep, and I woke up around 3 a.m. and then my sleeping schedule was completely destroyed. Because the next day, Sunday, uh, it was around 11 a.m. and then the pain just became unbearable, like very, very unbearable. Uh, More tightening. The shortness of breath wasn't that bad. I would say it was like a 5 or 6 out of 10. And um, so I was knocking on the door because, knocking on the wall and hoping to get like my mom's attention. First, she went outside to see if somebody was knocking on the door, knocked a few more times, and she didn't pay no mind, knocked some more. She walked in my room, but still my talking was like low because of the shortness of breath and all the pain. Like I can barely talk. And she left out, and then it got to the point where it started hurting a lot, and then I started crying, like literally started crying for the first time in like, I want to say, since 2011. It's 2020. This is my first time crying since 2011, over anything. And my body is like really hurting me. And so I got up, I got her attention. Like I went out into the hallway. She was in the kitchen, got her attention, told her what's going on. She got me some more ibuprofen, and she called one of my supervisors off my phone and told her that I wasn't gonna being at work today. So time goes by. Later in that day, she asked if I want to go to the ER or anything, and I'm like, no, I should be all right. And then the next morning, November 23rd, I told her, hey, I'm gonna just, the pain ain't going away, so I'm gonna go check myself in to the ER. So I go to the ER, and I absolutely, positively hate needles. And well, first off, why every time? So it's called an emergency room, right? I go there. There's 4 people in the lobby, right? There, why is it that when I'm dying, right? Every time I go to the emergency room, I'm there waiting in the emergency room for an hour. There's no way all them rooms is filled with people, bro. But, so I'm sitting there for an hour, and I finally get checked in, and then, like I said, I hate needles, so they were like, they gotta put an IV in me and whatever, and dog, I still flinch right now when because if you ever got if you never got an IV needle in you, God bless you. I hope you never do. But for those who have, it's a thick ass needle, right? Let's see. All right, it's about as thick as the gold part on this pen, right? And they stick it into your vein, right? Now, keep the size of that IV needle in your mind until the other part until I get into more of the hospital part. But they stick it into your arm, so then they can either draw blood or put medication in you, and that's how they do it, right? And I was so nervous and whatever, and then they started giving me some medicine. I forgot what the initial ones were, so I ended up they ended up taking me to go get some tests done. They put me on X-rays and everything, to see what's going on. And um, I got checked in. So I was supposed to be checked in to the hospital for about 2 days, right? But while I was there, they were saying, "Hey, you got blood clots all in your lungs, mostly the left lung, and that's what's causing the pain, the swelling, and all that." So I'm there. They, give me Percocet. Um, they gave me, uh, well, saline isn't a drug. They just use it to clean the IV, but you could feel it in you. And, like they injected saline, and it's in this thick ass. So the what is it? The syringe. That's the name of it. Is about this long and this thick, right? And I don't know how many milliliters were in it, but they inject all of it in, and then you can feel it in your nose, in your head, drain all in your body, and oh, you know, they had me doing ultrasounds where they can see. Well, first they did ultrasounds in the legs because with blood clots, that's where it starts at. I think they said all blood clots start in your leg, and then it makes its way slowly up to your upper body. So that's probably. So when the doctor told me that, first, first they said, do you have family history of blood clots or whatever? And I was like, nah. And then he started telling me, it starts in your legs and whatnot. So, I was then thinking, I did have problems in my leg. And then I told him the story. And then he said, all right. And I told my other doctor that because I had an ER doctor, which was a guy doctor. And then they transferred me to a female doctor. And I told her the story, it was the same answer, they, I guess because I didn't, thoroughly explain what happened in March, but so, we did more tests. I got an STD test to see if it was from STD, possibly. All STDs came back negative, like no STD in me at all. They checked the blood for cancer, no cancer in me. I think right now, they're still doing the historical background test. I think they're still looking at that, or they probably already told me that there's no lineage of it. Lineage, big word, your boy. But yeah, so no STD, no cancer, no historical background of it. Also, this go around, we're not sure about the first go around, but definitely this go around, I had a little bit of pneumonia, and sometimes pneumonia does cause blood clots. Pneumonia, cancer, there's a whole lot of things. I think it's like 9 or 10 things that can cause blood clots, but pneumonia and cancer are usually the highest ones. So we did X-rays. They drew blood. They drew blood from me a lot, and they hit me in 4 different spots. So it started here in this arm. Let's see if I. Yeah, it started here in this arm. They did this vein. But the way I would do the bed is, because it's an incline bed and you could put it down, put it up. So I would, adjust it, or it would be leaned back about 45 degrees. So when I try to sit up, right, I would have to bend this arm. And the IV is right here in the, right here in the middle, right? So every time I get up, it's kind of pushing the IV up more. Ooh, it's making my body, just think about it. And yeah, it kind of ripped through his skin and whatnot. So it eventually caused swelling in that arm, more in this area. So they gave me basically like a sports cream type thing. This joint, diclofenac sodium tropical gel, to put right here on the arm, and it reduces swelling, inflammation, like things like that, and so that's that. Then they started going for the hands, right? So between these hands, my left hand, which is my dominant hand, has the larger vein, which will be right here, right? So they would usually do the IVs in this one until it drained out, right? And usually when the blood drains out, they're usually not a vein anymore, so they try to switch over to this hand. No, you can't see it on this one, but one of my veins is right here, and they try to do the vein, but could not get into it. So then I forgot her name, but whatever. They did an IV here. I told the lady, you're not gonna find a vein there. The only vein is gonna be right here, right? This lady then proceeds. I don't know if it's still there. No, but she then proceeds to stick the needle in here, right? Does not hit a vein at all. Instead of hitting the vein, she hit like the muscle or whatever, and I can feel it hit the muscle and stuff, and it absolutely, it didn't hurt, but it's like something like grinding on your bone. Like you can feel the needle onto the muscle, and I'm like, yo, what? But I'm also, tired and whatnot, so I'm more nonchalant about it. I'm like, I'm like, I believe I was probably one of the most politest patients they ever had. But, at the time I was like, oh, it's okay that you can't find a vein and whatnot. But, so she took it out. It was my RN, and then they have some other, nurses. I forgot the name of them, but they usually come in and prescribe. Give me medicine, and they would check my blood pressure and oxygen levels, and it would piss me off so bad because I be trying to sleep, man. I be trying to sleep, and also there was like respiratory doctors, and they would put me on this nebulizer, right? And I'm gonna get back to the nurse, but they would put me on the nebulizer, and there was one where you had to inhale, right? And it's like blowing like air and salt. You can taste all the salt, and then it would go in. You inhale it, right? You gotta take a deep breath, inhale it through your mouth, um, And then there was another setting where you had to inhale, but then you had to blow into the nebulizer or whatever. But yeah, they would always come 3 a.m., 1 a.m., 3 a.m., 6 a.m., 7 a.m. You know, and it would always piss me off because I would try to sleep. Like they would come in like every 3 hours, 1 a.m., 4 a.m., 7 a.m. You know, and then I'd be trying to sleep and whatnot at like afternoonish area. You know, then they would come in. You know, and then they gotta give me medicine and whatnot. But yeah, back to this vein here. So I don't know if y'all can see it. This vein right here. I'm gonna try to get super close. So I don't know if y'all can see it, but there's a spot right here, here, a little one right here, and yeah, so those 3 spots right there, 1, 2, 3, and then the ones up here. Remember I told y'all about the size of that needle, right? Imagine telling the doctor or nurses, right? There's not a vein there anymore because it's been ran through dry. There's not a vein there anymore. So what you're going to have to do is you're going to have to move back to this arm and go to this hand, right? And it was hard to find a vein in this hand, but one day, I think the same day that there was no more vein in this joint, this vein just magically popped up and boom, they got it. But then there was a day where this was all drained out. This wasn't here no more. Can't find a vein here. Can't find one here. So they put a line in right here. Right here. They put a line in. And what they do is so it has to be completely sanitized, it has to be completely neat and everything. So they put a cover over your body, like they tell you to put your arm out, like you're laying down still and whatever, and they do it in your hospital bed in your hospital room. You know, you're laying down. They tell you to stick your arm out. They put a whole like cover over you, cover over here, cover under there, cover on the arm, and of course make you put a mask on. You know, they wipe the area clean and thorough, and then they numb you up. The numbing shot actually doesn't even hurt, but like y'all can see in my body, you know, I still squirm every time I think of a needle. But they do that, and then you don't even feel them put the line in, and it's dang, I wish I would have took a picture of it. Like the line was about as long as a shoestring. I kid y'all not. The line in. So how can I describe it? It's like a stringish type thing, and it's in your arm. And then what's sticking out is like the things that they had from the IV, the little medicine bottle, whatever. And then, you know, they can still draw blood, put medicine in and everything. You know, and do it like that. So I thought, you know, the doctors would continuously, you know, use that joint, you know, just to put the medicine. Because, like I said, I hate getting hit with that IV. But no, they ended up, you know, IV in my joint all the time. All right. So that's basically the main stuff in the hospital. And then it went to November 29th. I think it was the 29th or whatever. I was doing the nebulizer, right? And my female doctor, Dr. Germa, she was there, and if you ever find yourself at Centaur Hospital and, you get checked into the hospital, ask for Dr. Germa if you can. She's a real good doctor, and she like really cares about her patients, and take care of you, and make sure everything with you is good. So I'm doing the nebulizer with my right arm, and then I hand it back, and then all of a sudden my arm just, freezes like a muscle spasm, or like a strainer or whatever. And then she set me up with a ultrasound to happen later that day. And they did the ultrasound, and then that's when they found out not only is there like it's not infected, but the swelling. Now the swelling basically came from a little blood clot in there. So not only do I have blood clots in my lungs, I have a blood clot in my arm. And so after that, it's November 30th. I am supposed to go home. Dr. German wants me to go home, not only because I've been in the hospital for so long and I'm also recovering well, but what's it called? COVID has struck again. And in Virginia, Northern Virginia is the most populated area in Virginia. Mainly because, the government buildings in DC and whatnot, all the government jobs and stuff. So there's also a lot of lacking common sense type people in this area, and they love to walk around without masks. They love to. I remember I was at work still, right? And like I said, coronavirus is still hitting hard. And this was a little bit before November. This was like maybe October or whatever. And I was just sitting on the bathroom toilet, right? And I want to say a good amount of 3 or 4 people walked in, and I heard them all use the bathroom, and I did not hear not one of them wash their hands. And it completely amazes me how people are still like that with this whole situation going on. And even till this day, there's probably still people who still do that, but November 30th, I was supposed to go home because, like I said, COVID was hitting hard, and I was the only person on my floor, on the 3rd floor. There's probably either on the 3rd floor or just in my section. It was like about 8 rooms or whatever. I was the only person. So let's just put it like this. I was the only person in my section who did not test positive for COVID. I'm the only person in my section who does not have COVID. And then the nurses working with me, right, has to help them as well. So imagine that. Not only now does the nurses have face mask, like the plastic face shield, they also got their mask under that. Some of them even double masked under that. So she was trying to get me out for that. But I ended up going into a procedure. Let me make sure I get the right pronunciation for this joint. All right. So I had to go through a thoracentesis, right? And let me tell you a little bit about my life, bro. I've almost drowned in the pool. I was biking and down the street, and I turned my head to look and see where my friends were. 3 seconds later, I hit a parked car. I've played in a lot of football games, and there's this one team, Houston Ravens or something like that. They were from Texas, like grown men, you know. Um, One dude brought his child to the coin toss. I don't know if these dudes were even 16 at the time, but they might have been older, but brought their baby to the coin toss. I received concussions, right? I've broken my leg in a bike ride, once again, down the hill. Doing a little swerving thing and then swerved too much, landed, rolled, leg got caught in a frame, leg twisted, boom, boom, kind of snap, but like not a complete snap. Yeah, but none of those all together amounted to as much. What happened with that thoracentesis? All right, so this is what happened, right? I, they rolled me downstairs and they say, hey, it's black dude, right? And he was like, everything's gonna be cool, it's gonna be painless and whatnot, and blah blah blah. He told me they're gonna shoot you on your side, and then they're gonna put the catheter in you and then drain the fluid out. He made it seem like it's not gonna hurt at all. He was like the same, shot that they give you in the dentist when you get your wisdom teeth out, or your cavity filled or whatever. Same amount of pain, right? And I can take that. For some reason, I can take that, but just needles in the arms and hands. But all right, cool. It ain't gonna hurt. Say no more. Keep in mind, I'm just going through the line, and that didn't hurt at all. So now I'm trusting these doctors now, and so they prepping me. Ladies, washing my back and everything, sanitizing and whatnot, and then the doctor comes in, right? And he starts doing the ultrasound, because with thoracentesis, what it is they try to find fluid in your cavities and lungs, and what they do is they drain it out. So they numb me up, right? The nurse who was like comforting me, because once again I hate needles. She was like, she gonna tell me as they put the needle in. Like the doctor put the needle in, right? And she was like, here comes the needle. I'm like, I feel it, and it wasn't even that bad. It was like a little mini pinch or whatnot. So they did that and then took it out and then he shot me up with some more. And I was like, God dang, bro, twice. And then they put the catheter in, which is the same size of an IV needle. But the thing is, I couldn't feel it. So that's the positive thing. All right, here comes the terrible part. So, with the thoracentesis, right? Like I said, they drain the fluid out of you, right? And when you have fluid in your lungs, it causes your lungs to not expand much. Like a lot of air will not be getting into. So, right, I'm still hunched over. I'm laying over the table like this, right? And they start draining it. And then at first I could take it, right? And then after a while, it just got to me and I started coughing a lot. And they told me, past patients have been saying, you're gonna cough a lot, but other than that, it's nothing that you can't, you know, nothing that's unbearable or whatever. I start coughing. I'm like, right? And then it gets to a point where I'm like coughing, 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 coughing. And then I had to tell her, yo, she was like, you want me to pause it? Cause I can pause it if you want. I was like, yes, pause. And then she paused it, right? And then, I'm coughing, coughing, and and then I really didn't want to be there anymore, so I just told her, yo, go ahead, continue. She continued it, and then I'm still coughing, feeling like I'm about to cough my eyes out and everything. And then she what she do? What she do? What she do? She was like, it's not draining anymore. I think it's done. And then uh, I'm sitting there coughing uncontrollably. Like now I have no more control over this cough. Like I'm just coughing, and she and now I'm trying to like she was like, so we're gonna have to take the catheter out and whatnot. She was real polite. She was like, she wasn't like, yo, stop coughing so I can take this joint out. She was like, so when you're ready, just let me know. I can take it out. And I'm like, and then I try to control my coughing to the point where she can just take it out. So I was like, all right, go ahead. She was like, all right, don't cough. I'm about to take it out. So I'm holding this joint in. I'm about to explode. And she slides it out. And I can feel her slide the catheter out. And I'm like, oh. Yeah, she slides it out. And then I go into uncontrollable coughing. And I'm coughing so bad. I'm heating up. I'm sweating. I'm feeling like I'm about to die, dog. Like landing on my back, about to die in the swimming pool, hitting a parked car. Well, I actually hit a parked car twice, I think. Football hits, all of that combined was nothing to what I endured with that procedure, bro. That was literally the worst thing I have ever had to go through, and I would not wish that on my worst enemy. Even though I don't have enemies, if I ever found an enemy, I would never wish that on them. Because that pain, bro, oh my gosh, is it's not something, you know, to play around with, man. But so then they tell me, so we get that under control and whatnot. So then the doctor tells me, I can't leave that day. I gotta leave the next day. That Tuesday, I had to do another X-ray, to see the progress on, from the first X-rays that are done to the X-rays that are done now. Well, to that point, to see if the clot's cleared up and whatnot. I also did some more, what's it called? I wouldn't call it physical training, but they had me walk around the room to, check my oxygen levels and everything. Make sure, because they don't want your oxygen level to be under 90%. Because that's actually a good breathing rate. And for you to drop under 90 and then you be out on your own, it's, not good at all. So they want to make sure, I was being able to breathe, pretty well before I go out there on my own. And, yeah, they also gave me a spirometer, and this is a spirometer, right? They want me to be able to get to 2,500, right? So with this spirometer, what you do is You gotta inhale, right? And you want to get this blue piece up as far as you can while keeping this blue piece in between these arrows. So it'll be so at first when they first gave me this, while I was in the hospital bed, like I want to say the 5th or 6th day, I can only get up to 500, and that's terrible, you know. But then slowly and surely, I got up to 750, got up to 1,000, and now I can get up to probably like 2,500. So it'll be like this. Oh. But you know, you just breathe in, and then so you breathe in, and then you hold it for 3 seconds, and then you exhale. So it's like this. Right. And then so right now I only got it to 225. Like 275 or two what's in between 2,000. Goodness gracious, boy, my math is all 2250. Boom, got it to 2250. But so I gotta do that like 10 to 12 times. Breathing. We try to go for every hour, but it's every 2 hours, every 3 hours. But yeah, I pretty much been since I've been home. You know, I've pretty much just been. I wouldn't say doing nothing. You know, I'm either gaming or video editing or on YouTube like I am right now, but I got it paused. I've been playing some flag football as well. Basically trying to see where I'm at. Yeah, and then about to start working again soon. Life, man. You never know what'll happen, right? So just, you know, take care of your body, man. That's all I can really say. Just take care of your body and let your body take care of you. You know, because, you know, had a quarantine for. Actually, they never really told me how long I was supposed to quarantine, but they just told me like stay away from people as much as I can, you know, or you know, I need something from the outside, you know, ask a family member to see if they can go get it. But after like 14 days, because usually you quarantine for 10 days, 10 to 14 days. So after the 14th day, you know, if I needed to go to the grocery store, I go up right up the street, and you know I'll have my mask on. You know, I didn't wear gloves, which was the bad part, but I had sanitizer in the car, and I got sanitizer wipes from the hospital. You know, I always wipe my hands down and everything, especially when I get home. I also got wipes in the car, so I can wipe down the inside of my car and cleaning materials as well. From when I wanted to be a car detailer, but yeah. So I've been quarantined, and you know, and it kind of felt weird having people do stuff for you, you know, because I'm the type of person who does not want anybody's help. I don't want people to do stuff for me. I don't like when people buy me stuff. I don't like any of that. But yeah, you know, all the family support, all the friends support and everything. You know, people checking up on me. it started to get less and less after a while. But for those who, consistently, checked in on me, I appreciate that. Uh, yeah, man.